So I'm doing a speech on pregnancy and chiropractic care, and I know I'm supposed to be standing, but I have a heart monitor on, so I'm going to sit before I pass out. But pregnancy is a long, grueling process. You are sick for weeks on end. Your body hurts from stretching in ways it never has before, and you are tired all the time. Pregnancy is not easy. It can be miserable, painful, and mostly just annoying. Yet, at the same time, pregnancy can be beautiful, fascinating, exciting, and life-changing. When you are pregnant, everyone is so quick to jump in and give you advice on what you can and cannot do, what you should be eating, how you should be exercising, whether you should go to this hospital or the next, what you should buy for the baby, whether you can get a massage, take a bath, or even see a chiropractor, and they go on and on and on. In reality, people tend to only tell you their horror stories and give you information that is useless. But I am here to inform you that chiropractic care can be very beneficial for an expecting mother like myself. It can aid in pregnancy symptom control. It can reduce the time of labor and delivery, relieve your aches and pains, and has even worked for some women to prevent breech and potential C-section. The first trimester of pregnancy is the date from the day you miss your period until the end of week 12. It is a very long time period where many expecting mothers experience morning sickness, dizziness, fatigue, and headaches. According to Genevieve Smith from the Joint Chiropractic, she is a certified chiropractor, she's got her license. Morning sickness, nausea, and vomiting can be exacerbated by a pinched nerve. A spinal adjustment may help ease some of the discomfort and less pleasant symptoms of pregnancy. When your body is misaligned, it can cause tension and pressure on your spinal cord and your nerves. This can also affect different parts of your body depending on the nerve path. So your nerve travels from your brain to like your arm or your leg. And this can cause fatigue, dizziness, and headaches from the entrapped nerves cut in the muscle tension. So according to an article posted by Birth Without Fear, this is a blog created by doctors, pressure and tension on the nerves in your mid to upper thoracic spine, so that's like from your neck to your mid-back, may lead to decreased function of the heart or lungs. This may result in added shortness of breath, high blood pressure, and dizziness, adding to the risk of preeclampsia. Another reason for seeing a chiropractor when you're pregnant is because it can help reduce the time of labor and delivery. According to Genevieve Smith, or Dr. Smith, adjustments to your spine and pelvis can have the effect of shortening labor and decreasing pain. That's because when your hips and back are in proper alignment, your nerve pathways are cleared to move freely to your muscles, and birth can continue without fewer agitations and pain and cramping. Some of the ways that your chiropractor will help you to reduce your labor and delivery time, aside from just massage and spinal adjustments, is that they will also walk you through safe exercises and stretches. Performing these exercises will strengthen your muscles, giving you more flexibility, which is also very important throughout your entire pregnancy as well, because you're huge and you need to be able to move. Chiropractic care can also help an expecting mom with the everyday aches and pains that come hand in hand with carrying a child. When a baby gets bigger, it affects your posture. Many moms start to arch their backs to counterbalance the weight of their baby. Although changing your posture may temporarily help with the strain of the baby's weight, a chiropractor can treat the aches and pains by performing a spinal alignment or an adjustment to improve your posture, and massage therapy to release tight muscles and reduce the pain. Pregnancy, like I said earlier, puts your body structure under more and more pressure every day. As your spine bends and curves in new ways in response to these changes, your chiropractor can target certain areas of your spine and adjust certain areas to focus on posture and maintaining the natural curve of the spine. There have been many cases that I have gotten to help treat with, or I've heard from other mothers that are expecting or have had children that have gone in for chiropractic care to help treat their breached baby. The doctors can actually physically turn the baby in the belly, or they can adjust and the baby will naturally turn on its own. In another article written by Genevieve Smith, as your skeletal structure changes with pregnancy, your hips and your lower spine shift. Improper positioning of your lower body can encourage your baby to move into an unideal position for birth. They could be on their side, they could be turned completely around in a 180, or they can be completely flipped sideways. By focusing on certain places in your spine, chiropractic adjustments can help your baby move to the ideal position. So the Journal of Manipulative and Physiological Therapeutics reported in their July-August edition or issue in 2012 that 82% success rate of babies turning vertex when doctors of chiropractic use the Webster technique. So the Webster technique is literally when they take their hands and they push on your stomach to flip the baby. Optimal baby positioning at the time of birth also eliminates the potential for dystocia or difficult labor, resulting in easier and safer deliveries for both the mother and the baby. So like I said in the beginning, chiropractic care can be very beneficial for an expecting mother like myself. It can aid in pregnancy symptom control. It can reduce time of labor and delivery, relieve your aches and pains, and has even worked for some to prevent breech or cesarean section.